I'm Dr. Steve Claypool, and I'm reviewing the medical evidence of the consumption of tea on health.
For this discussion, tea is defined as a beverage brewed from the leaves of the plant Camellia sinensis, which is a shrubbery. The leaves are used to brew black tea, green tea, oolong tea, and white tea. We primarily consume either green tea or black tea in the U.S. Green tea is a lightly processed version of this leaf, which preserves more of the polyphenols present in the fresh leaves. Black tea is created by fermenting the tea leaves. Herbal teas are brewed from other crap herbs, not the tea leaf. Herbal teas are not reviewed in this video. This meta-analysis, published in 2015, reviewed 22 prospective cohort trials that were pooled together and analyzed. The combined studies followed about 850,000 people for many years. Total tea consumption, whether black tea or green tea, was tracked, and after controlling for multiple risk factors, tea consumers were compared to non-consumers. Drinking tea was associated with a reduction in all-cause mortality. Maximum benefit was noted at 3 cups of tea per day, with a reduction in death of 24%. Tea drinkers had less heart disease, fewer strokes, and a reduction in cardiac death.
How might tea reduce all-cause mortality? Does it make sense?
Tea has a favorable effect on blood pressure. There have been dozens of randomized trials where half the subjects are assigned to consume tea and the other half of subjects are instructed not to consume tea. Blood pressure was measured in both groups over weeks to months. These two recent meta-analyses pooled the randomized studies to assess the impact. They both show that tea lowers blood pressure. In some of these trials, half the participants were assigned to take pills that were filled with tea leaves. The other half of participants received a placebo. The studies were double-blinded, meaning that neither the participants nor the researchers knew if the participants were taking tea pills or placebo pills. Blood pressures were measured, and over months, the blood pressures in the tea groups were reduced. The blood pressure lowering effect from tea is modest, but it's real. It's more significant in green tea than black tea, but it's a modest effect for both. Just like with blood pressure, there have been multiple randomized trials assessing tea's impact on cholesterol levels, including 2 different recent meta-analyses that assessed the pooled results from all studies. And some of these studies also used tea in pill form versus placebo. From these trials, we know that tea lowers cholesterol. Like with blood pressure, green tea is more effective than black tea, but both forms of tea have a beneficial effect on cholesterol levels. And tea's impact on diabetes has been studied. This meta-analysis assessed 17 randomized trials. These trials were predominantly overweight people, people with pre-diabetes, or even patients with diabetes. Like the other trials for blood pressure and cholesterol, some of the trials randomly assigned the patients to drink tea, and some randomly assigned them to tea pills versus placebo. Green tea in particular reduced blood sugar levels, both serum glucose and hemoglobin A1C, and fasting insulin concentrations. The reductions were modest but statistically significant. So in short-term trials, tea has favorable impacts on diabetes, and it may reduce the risk of development of diabetes.
But the development of diabetes takes time. It can't be assessed in short-term randomized trials. So next, let's look at long-term prospective cohort trials.
Here's a meta-analysis that reviewed 7 prospective cohort trials that followed about 285,000 people over many years. Tea drinkers had about a 1/5 lower risk of developing diabetes than non-tea drinkers.
Tea has favorable effects on blood pressure, cholesterol, and blood sugar. These are likely the mechanisms that reduce mortality.
Note that the blood pressure and cholesterol lowering effect of tea is modest compared to other foods. For example, nuts lower cholesterol much more than tea, and tea is not one of the most effective substances for reducing blood pressure, but we'll cover that more in upcoming videos. Let's switch to the healthful food scale. Green tea goes here, and black tea is right below it. But many people add stuff to their tea. What about sugar and cream? Does that make tea unhealthy? Sugar will attenuate the benefits in blood pressure and blood sugar from tea. In fact, cold, sweet tea as it is served in the South, which is loaded with sugar, does not have the same benefit as warm tea in trials. But for warm tea, the trials assessing tea included people that add sugar, cream, and milk to their tea, and regardless of the additives, there appears to be benefit overall from warm tea. Tea's benefits seem to outweigh the negatives if additives are used in moderation. Tea has some caffeine. With coffee, there's concern that the caffeine content may lead to osteoporosis and bone fractures. Is that a problem with tea? Probably not. Tea has much less caffeine than coffee, and some formulations have no caffeine. And based on this study, unlike coffee, there was no association between tea consumption and fractures. Based on current data, there are no negative health concerns for tea. If you enjoy tea, I recommend you make it a regular part of your diet. I suggest 1 to 3 cups daily, but feel free to drink as much as you want. The only downside is that you'll have to pee a lot. Tea has favorable effects on blood pressure, cholesterol, and diabetes, and is associated with reduced death from heart disease, stroke, and all-cause mortality.